What people need to understand is our muscle, our lean tissue, is very intimately correlated with our metabolic health.
Dr. Jaime Seeman, thank you so much for joining me today.
Yeah, it's great to be here.
So you just finished your talk at the COSI conference.
Yes.
Strong over skinny.
Yes.
So, we hear so much about weight loss. And when you think about weight loss, you think about trying to get skinny.
Mm-hmm.
Why strong over skinny?
So I'm in women's health. I take care of women. I see them every single day in my clinic. And I see so many women who it is their goal to get thin. There's always this perpetual 10 pounds they're trying to lose, or maybe if it's more than that. And what we focus on in medicine is we focus on them losing fat. And we know, even with use of these GLP-1 medications, right, 30 to 50% of this weight loss can be lean tissue. And what people need to understand is our muscle, our lean tissue, is very intimately correlated with our metabolic health. And so sometimes it might just be changing the way we think about weight loss, that maybe if we try to get stronger, that weight loss will naturally happen as we're trying to increase the strength and health and quality of our lean tissue.
Yeah.
But it's definitely something that we have missed the mark with in medicine.
Do you get some pushback from women saying, stronger, I don't want to get bulky and big. Like, that's not what I want.
Absolutely. And that is something that myself as a woman went through. Being a collegiate athlete and then going to medical school, I was like, I don't want to lift weights anymore. I just want to do cardio. But what women have to understand is that for a woman to get as bulky as she's imagining in her brain, like the Incredible Hulk, you would probably have to be taking some sort of anabolic steroid. So yeah. I dare any woman listening to attempt to try to achieve that type of physique. It would take years of training and likely some help along the way.
But funny how sort of the societal construct kind of goes that way. Like that's the assumption, because the societal construct is, and I even hate to say this out loud, but women should be skinny, right?
Absolutely.
Look thin, be in a bikini body, whatever you want to say.
Yes.
But that's not always the same as healthy, is it?
100% I resonate with that. I was a collegiate athlete, like I said, and we think that muscles are correlated with men. Like boys should be strong and men should be strong, but women should be, soft and petite and quiet. And the societal pressures and norms have definitely done women a disservice, because a particular moment in a woman's life when she goes through perimenopause and menopause, if she is not strategic about maintaining her strength and her mobility and her lean tissue, her risk of cardiovascular disease, diabetes, osteoporosis, cancer starts to skyrocket with the loss of estrogen.
Yeah, and you think the correlation with lack of muscle has to do with metabolic health, or are there other factors in there?
Yes. The amount of muscle tissue on our body, the strength and the quality of that lean tissue is a predictor of mortality, and that includes metabolic disease.
Yeah.
Muscle is the greatest disposal agent of glucose. So if we talk about, insulin resistance and diabetes and the glucose problems that women have, if they had more healthy lean tissue, they would have a better resiliency to dietary glucose.
Yeah. Now, what if someone is doing resistance training, they're really trying, and they're following the dietary guidelines to get, 0.8 grams per kilo of protein, so getting maybe their 50 grams of protein per day, and they're just not seeing their muscle improve? How do you help women around that?
Well, what people have to understand about resistance training is that it has to be progressive. So, women may be going, we're really fed, like maybe they're using the small little tiny pink dumbbells. So movement is good, but it really has to be what we call progressive overload. So our bodies are physically capable of so much more than women really allow themselves to even believe. And so it's really about starting at one weight, increasing to the next weight, and then incorporating less cardio into our lives and more things like sprint training to increase like our type 2 fast twitch muscle fibers. There's so much more to our health than just movement, just eat less and move more.
Yeah. And what about the role that protein plays in helping you build muscle?
Yeah, so dietary protein is extremely important, because these amino acids, we turn them over every single day. So our body is constantly recycling amino acids, and part of that requirement is dietary protein, specifically branched chain amino acids like leucine. So if women aren't getting a meal that contains 20 to 30 grams of protein or 2.5 grams of leucine, they're not eating enough dietary protein to stimulate muscle protein synthesis. So women in particular, because they kind of graze or they just eat small meals and snacks, they're not getting this large bolus of protein that's stimulating the lean tissue. So women would be better served eating a larger proportion of protein, especially at the first meal and the last meal of the day.
And what are some foods that are high in leucine so people can sort of draw the connection?
Well, the most nutrient dense food that's going to have a lot of leucine is going to be animal foods. So chicken thighs, cottage cheese, most of these animal foods, beef, chicken, fish, whatever, your dietary preferences, you can get them from plant foods. But the amount of leucine, if you were to eat plant foods, you'd have to be eating like 2 cups of beans. I mean, it's an incredible amount at a larger caloric density and a larger carbohydrate intake as well. So if we're going for efficiency, it's going to be animal foods.
Yeah. So, and you're talking about getting enough protein with each meal. And we've also talked about sort of, stereotypes and the way we see things. For someone to sit down and eat 3 eggs, like, I hate to say it, but a lot of people think that's really a lot of protein.
Yeah.
It's a big meal. Is it?
I think what people will find is that when you're eating adequate amounts of dietary protein, it's very satiating.
Yeah.
So when you're actually giving your body what it needs, you start to get these responses from your body. They're like, okay, that's enough. You've done a good job, right? But we're eating low nutrient dense foods, tend to be higher in carbohydrates and fat, and our satiety signals are not correct. So it's pretty amazing when you start prioritizing protein, how much satiety almost takes care of itself.
Yeah. And you showed a slide that I got to admit is kind of a depressing slide, which shows sort of the rate of decline of muscle mass as we age.
Yeah.
But I think you'd also agree it doesn't have to be that way, does it?
100%. So if we do nothing, if we sit by passively, we start to lose our muscle mass, strength, and power in our 30s, and it really starts to accelerate in our 40s when we're getting closer to menopause and andropause. But if we take the strategy that we care about being strong and stable into that, decade and next chapter of our life, we reduce our risk of dying of anything.
Yeah, such an important message. Well,
Yes.
Thank you. If people want to learn more about you, where can they go to find you?
You can find me on socials, Dr. Fit and Fabulous or drfitandfabulous.com.
Dr. Fit and Fabulous. I
Yeah.
love it. Thanks for joining me.
Thank you, Brett.